Hello, I'm Dr. Shauna Pittman, clinical pharmacist and instructor for the Pharmacy Technician Certification Program in Northern Virginia. And I'd like to start my first video today by saying my passion is to improve the experience for all in healthcare. I want to empower and educate patients to be partners in their healthcare, and also to model empathetic understanding toward patients to my healthcare peers. So today I want to do a brief video to give you some tips and tricks to memorize the Sig codes, or the abbreviations we use for prescription directions. There are a lot of abbreviations, and there are some that can be easily confused and some that can actually lead to errors with medication. The first that I want to show you today are the codes that start with Q. So Q essentially means every. So whenever you see Q preceding something, it means every day, for example, is QD, every 4 hours, Q4H, or Q4HR, etc. So it might be Q1 to 2H, and that's every 1 to 2 hours. Now I will point out that these definitions, or these abbreviations, QD and QID, are on the ISMP's official do not use abbreviation list. And the reason is these can be easily mistaken for one another. Sometimes we would write QD with a period after the Q and after the D. And depending on where this is written, if it might be a carbon copy sent to the pharmacy, for example, or a handwritten prescription, that could be mistaken for QID and vice versa. QID is 4 times a day. And the hint here is Q is quad. Think of a quarter. There are 4 quarters in a dollar. And so QID is 4 times a day. Likewise, TID is 3 times a day. Think of tri, like a tricycle or triathlon. So TID is 3 times a day. And then BID, think of bi or bicycle. A bicycle has 2 wheels. And so BID is twice a day. Now here's one that can be confused, and that is when you see the letter A and then the letter P. So an example here is if you see AC, that's before meals. If you see PC, that's after meals. And so we might think that A is for after. A is actually represents the word or the root ante, A-N-T-E, like the ante room in our sterile compounding area is the room where we prepare to enter into the clean room. So we get our supplies together, we don our personal protective equipment, etc., to go into the clean room. So that's the ante room before you go into the IV room. P is post. Like you'll see this post-op, for example. I mentioned after meals, PC. So these are often given with medication directions. And the last set here that I will go over are the ones for eyes and ears. And now that we have electronic prescriptions and e-prescribing by the providers, it's not as often that we need to interpret these. But when you see the letter O, that indicates an ocular use. Think of, so it's into the eyes, ocular, like optometry, for example. A is, think of auditory, and this is for the ear.